Yeah, sure.
Thank you.
Please.
So let's wait for people at least because this is 2:36 Nigeria local time.
Okay,
So let's give at least 2 minutes for
sure.
others to join because doctor has other engagements.
Yes.
So he has other appointments. So let's give 2
conclude.
minutes for others to join.
Yeah, we'll conclude in 30 minutes once we start. Professor Hishmat, how long would be your presentation? Do we have any time to take any questions from the audience in the end?
I'm flexible. I can make it very quick and I can elaborate more. So I think
If you
it's
could
gonna
make it your presentation for 15 minutes, and then
15. I'll
then
try
we
to
could
crunch
take
it into 15.
some we could take, or 15 to 20 minutes. Then we could take few questions, couple of questions at least from the audience if there is any questions.
Sure.
Yeah.
We can do that. No problem.
Perfect, perfect.
You are in Oman now?
Yes, doctor.
do not-
Noman.
All right.
In Muscat?
Muscat, yes. You're in Dubai?
The weather's yeah.
Right.
And
I
the
used to
weather's
be in
daylight.
Dubai.
Excuse me?
I used to be in Dubai earlier.
Yeah, the weather now is lovely in the region.
Very pleasant. Very pleasant.
Yeah.
Mm.
Okay, I think we can start. So because I told everybody to meet up the time, so we can start. Whoever join us, then we can benefit from maybe time left.
All right, let's go ahead because we can,
Time.
if somebody comes in, we can start. I'll just finish the introduction and then I'll give the I could do the host to make Dr. Host. I have given you the host rights, Dr. Hishmat, so
Sure.
be able
I
to
can
do
see.
the screen share. And I would like to welcome all of you for the very first session of a live webinar. Our intention to host as much as possible to do a scientific sessions where we provide information to the people, especially for non-clinicians who always becomes the best bridge between the patient and the caregivers. And the more we are empowered with the knowledge, that is when we will be able to provide corrective measures and the support that is required for the patients who are looking for various kind of treatments. So that is an intention for all of us. And I'll also like to congratulate Usman for taking this kind of an initiative, because spreading knowledge is the best investment that anybody can do. And congratulations, Usman, for doing this. And we will continue to do this.
Thank you.
Yeah, we
Thank
will,
you.
encourage more and more people to join us to have this knowledge. And with lot of pride and lot of happiness, I would like to introduce Professor Hussein Hishmat, who's a professor of cardiology at Cairo University and a senior interventional cardiologist in Dubai. He's a fellow of the American College of Cardiology, fellow of the European Society of Cardiology, and the fellow of American Society of Cardiac Interventionists. So you can imagine having all the boards of international levels. We can completely be confident about the level of expertise Professor Hishmat comes on board with us. He's also the associate editor of the Egyptian Heart Journal. So the best part for the region is another factor, that being bilingual, able to speak Arabic for this region, I'm sure it adds a lot of value, Doctor. And over 25 years of experience, he's performed thousands of coronary, valvular, and vascular interventions. He has won 4 prizes and awards in interventional cardiology from Egypt and from the UAE. So it's our privilege today that we have Professor Hishmat with us. Everybody who is watching us live right now, and also probably they will watch later the recorded version when we launch it in the digital platforms, will benefit from this important topic, because we see that diabetes is actually becoming like a pandemic. It is spreading so much across the region, especially here we see lots of incidents of diabetes across various age levels. And it's very important for us to understand when diabetes is interlinked with cardiac issues. And today's topic, we are going to discuss about how diabetes affects the heart and what can we do to prevent it and what are the precautionary measures that we can take. So with this, I'd like to request Professor Hishmat for taking us through the presentation today. The screen is all yours, Doctor. Over to you.
Thank you, Mrs. Vidya, for the kind and wonderful introduction. I am just going through the journey of learning. I started the journey several decades ago, and I continue to learn, trying to learn every day. And I'm glad that you're giving me this chance to engage with the people from Africa, because I'm originally from Africa, of course. So I will share the screen now. I hope you can see the screen.
Yes, we can see.
Yeah.
Yeah,
Yeah.
very clear.
So I will take you quickly to the problem of diabetes, focusing on Africa, and how can we protect the heart from diabetes. And I will try my best that the talk balances the scientific language, because I guess we will have some physician colleagues joining us, as well to make sure that it's clear enough for even for the non-medical professions. And our job is to save lives and to fight death. And as the nations evolve, we move from mortality due to wars and armed conflicts, and then mortality due to infections. And I know Africa is suffering a lot from malaria, from HIV, from other infectious diseases. And then as Africa is evolving, we see that the economy in many countries is improving. The nations are growing and leading their history and leading their future. So as the societies become affluent, then we start to see an increase in cancer and in cardiovascular diseases. And as Mrs. Vidya mentioned, diabetes is like a pandemic. Roughly 1 out of every 8 individuals on the planet have diabetes, which means that we have around 750 million or close to 1 billion, if we add diabetes and pre-diabetes, patients on the planet with diabetes or pre-diabetes. And the projections of the National Bank that by the year 2050, 10%, roughly 10% of humans will have diabetes. So imagine 1 out of every 10 individuals having diabetes. And it's not the developed world. Diabetes is also a silent killer in Africa. And this is not my opinion. This is the opinion of the World Health Organization. And looking at how diabetes is expected to grow from 2021 till 2045, we expect that only in Africa we will have like 55 million individuals with diabetes. And Nigeria will be the second runner or the first runner for the growth of diabetes in Africa. And we expect that number of deaths due to diabetes will be 416,000 in this decade. And when we speak about death due to diabetes, it does not happen because of hypoglycemia, it does not happen because of blindness, but it happens because of cardiovascular disease. So the number one killer of an individual with diabetes would be a cardiovascular disease, would be a heart failure or coronary disease or a cerebral stroke. That's why cardiologists are strongly involved in diabetes, keeping in mind that cardiovascular diseases now represent 13% of all the causes of death in Africa, with annually 1 million mortalities due to cardiovascular disease in Africa. And again, West Africa and Central Africa and East Africa are having very high numbers of cardiovascular diseases. And West Africa is especially having the lion's share of the growth, which is expected to happen in the coming decades. And the question is, how does diabetes affect the heart? I will not dive into molecular mechanisms. These do not concern even the clinician, but we know that patients with diabetes have double the risk of having coronary disease and heart attack. They have triple the risk of having heart failure, and they have 5 times the risk of having occlusion of the lower limb arterial vessels. And again, statistics from another location from the United States find that cardiovascular death represent more than 2/3 of the death in diabetes patients. And our understanding of diabetes has evolved over the last 100 years from just a mere state of hyperglycemia and blood sugar elevation to a situation of obesity, metabolic syndrome, insulin resistance that gets complicated by diabetic retinopathy, diabetic nephropathy, and inflammation of the nerves. And then finally, the fatal event is likely to be a myocardial infarction, a cardiac death, or a stroke. And cardiologists do not like diabetes because when we have a diabetic patient coming to the cath lab, we know that they will have multi-vessel disease. They will have occlusion of more than one vessel. Unlike patients with non-diabetes who would have only a focal lesion or a single vessel and can be treated easily. Even when we treat them, we know that in-stent restenosis occurs 4 times in diabetic patients compared to non-diabetic patients. And I'm sorry for the graphic images. The infection of the wound after coronary bypass surgery is 3 times more likely in patients with diabetes. So cardiologists, we do not like diabetes. And the question is, if I am a diabetic patient, what should I do to prevent getting myself a heart attack or a stroke or heart failure? Then we need to assess the risk, and then we need to manage that risk. So for a diabetic patient, we have a score. This score has been developed from the European Society of Cardiology. It's available in the App Store of iOS and Android. And what every patient can do is that he can log into the application and enter his data. When did he start getting diabetes? What's his kidney function? What's his age? Does he have any established heart disease or not? And then he can come with assessing his risk or her risk of developing heart disease in the coming 10 years. And we know from research on the ground, I was one of the investigators in this study that looked at people from Africa, from Asia, from North Africa, looking at patients with diabetes. They found that 1 out of every 5 patients with diabetes will already have the disease. By the time they are diagnosed with diabetes, they already injured their heart and injured their blood vessel. And for the remaining 80% who do not have a clinical heart disease, 99% of them would have high risk of developing heart disease in the future. So what should we do after we know the risk? What should we do to protect the heart in patients with diabetes? There are many things to be done because diabetes affects the heart and the blood vessel through different ways. So we have many things to do in order to mitigate this risk. We can look at diet, exercise, blood sugar, etc. And to make things easier, there's a nice acronym, which is A, B, C, D, E, and 3 S's. This was originally developed by the Canadian Society for Diabetes, but it's very helpful for patients and for doctors to remember the A, B, C, D, E, S. And we will go through them one by one to understand how to reduce, how to protect the heart from the risk of diabetes. So let's take them one by one. As I said, A, B, C, D, E, then S, S, S. The first is the letter A, and A stands for hemoglobin A1C. This is the average of the blood sugar for the last 3 months. And we need to keep that percentage below 7%. Because if the percentage above 7, it means that the blood sugar is uncontrolled. And this can damage the retina, can damage the kidneys, and can damage the nerves. So the blood sugar, the blood sugar needs to be controlled, looking at the hemoglobin A1C and testing it every 3 to 6 months. B is for blood pressure control. Patients who have diabetes frequently have also high blood pressure because the risk factors are the same. Diabetes can cause heart disease and hypertension can cause heart disease, and when they are combined together, they have a synergistic effect on cardiovascular events. So the B stands for blood pressure. We need to control the blood pressure. And hypertension is much more prevalent in the world than diabetes. Roughly 1 out of every 4 individuals or 5 individuals in the world will have hypertension, which means that roughly there are 1 to 2 billion individuals who have hypertension in our lifetime. And you see here the map. Africa has a high and a rising prevalence of hypertension that can reach more than 50% in some countries like South Africa. And controlling the blood pressure, the B, is one of the very rewarding interventions that anyone can do, because if we reduce the blood pressure by just 20 points, 20 millimeters mercury, we reduce the cardiovascular risk by almost 40%, which is almost 1/2, just by controlling the blood pressure. Ideally, we should bring it below 130/80. In the elderly individuals, they usually do not tolerate these low numbers, so we can go to 140/90. But the minimum thing that you should do is to reduce the blood pressure by 20 millimeters mercury. And we have some preferred medications like ACE inhibitors, like angiotensin receptor blockers, that help to lower the blood pressure and to protect the heart and the kidneys. So A for hemoglobin A1C, B for blood pressure, C for cholesterol. And the word cholesterol is a very simplified word for what exactly happens. The real cause of blocking the vessels is lipoproteins, and these lipoproteins is the way that cholesterol moves inside our blood, where it is surrounded by a shell of proteins. And these lipoproteins, some of them are useful and some of them are harmful, the villains. And the villains are the LDL, low density lipoprotein, intermediate density, and VLDL. And these agents and these molecules need to be brought down to earth. So in patients who have diabetes, the higher the risk, the lower we need to go with the blood cholesterol. We usually, in patients with diabetes, we like to keep the LDL around 100. And as the risk increases, we like to reduce the levels of LDL further and further. Now we have many tools to lower the harmful cholesterol. Previously, we had only one tool, which is the pills, the daily pills, the statins, atorvastatin, rosuvastatin, and they are very useful, but they have some limitations on taking a daily pill. And they have a limitation sometimes in their strength. So now we have stronger agents that can be given once every 2 weeks, once every 4 weeks, or even once every 6 months for those patients who do not reach their target cholesterol just with the pills, or for those patients who are not able to take a pill every day. So we have now injections to lower the cholesterol that can be taken every month or every 6 months. A for hemoglobin A1C, B for blood pressure, C for cholesterol, D for drugs. There are some drugs that lower the blood sugar, and in the same time, we know that they protect the heart. Mainly 2 classes of medications. One of them is in the form of a tablet, and the other is in the form of the injection. Let's take them one by one, especially the injection, because they have been chosen by Science magazine to be the breakthrough therapy of the year 2023. They are called GLP-1 therapies. These therapies are injections that the patient can give to himself. He doesn't need to go to the hospital or the clinic to take the injection. Unlike insulin, which is given daily or more than once daily, these injections are given once every week. just one small shot every week that can do marvelous things. These injections can improve the blood sugar, and they result in a significant reduction of body weight. The newer generations can reduce the body weight by 15 or 20%, to the extent that where I live, bariatric surgery used to be very common, and surgeons were living off bariatric surgery. Now, with these once weekly injections, and people are able to lose weight, control their blood pressure, protect their vessels. Now bariatric surgery is declining, and the surgeons, my colleague surgeons, are complaining about that. And the benefits of weight loss are directly proportional to how much weight you lose. If we lose just 5% of body weight, then we can prevent diabetes and we can correct cholesterol. If we lose more than 15%, then we can prolong lives and we can treat heart failure and we can put diabetes into a complete remission so that patients do not require even taking a pill for the blood sugar. The other group of medication is in the form of pills. They are also doing wonderful things in terms of protecting the heart, protecting the kidneys, protecting the brain from the effects of blood sugar. And now these agents are recommended in all the international societies because these pills can control the blood sugar, protect the kidneys, the blood vessels, and the heart just with one pill every day. Now we move to the letter E, and that stands for two E's actually. One is eating and the other is exercise. Eating is very important. One of the main reasons why societies develop diabetes is because the change in the lifestyle and the industrialization. And in this slide, I'm putting the good and the bad. The good is the green, the fresh, the unprocessed food, fruits, vegetables, pulses, and seeds. On the right side, the harmful, the bad types of food, which are fast food, junk food, fried food. So let's look into more details. The good guys are the protective ones. These are we call them the DASH diet. This DASH diet is the one that has vegetables, fruits, legumes, whole grains, olive oil, and fish. This can be easily consumed in Africa and in many parts of the world, and around in the Mediterranean. They reduce the mortality, imagine that, by 40%. If you move your diet towards vegetables, fruits, legumes, olive oil, and fish, you can prolong your age. You can live longer, free of heart disease. On the other side, the villain are the trans fatty acids. These are found in pizzas, found in fried food, in the sauce, in the donuts, in the French fries, in the burgers. And these trans fats are essential for preservation of food. That's why any food that is processed and has a shelf life and has an expiry date must have some form of trans fatty acids, and these are usually harmful. They cause diabetes, they cause inflammation, they cause abnormal heart rhythm, and they cause heart attacks. What foods contain trans fatty acids? These are the ones that we just mentioned: the burgers, the fries, the pizza, the sauce, etc. The other villain are the refined sugars. And these refined sugars increase the risk of heart disease by 50% and increase the risk of stroke by 30%. These refined sugars are found in chocolates, in sweetened beverages, in sugar, in the pasta, in even sometimes in the white bread, in the cakes, in the cookies, and all these foods. So we need to avoid them. Dairy products and saturated fats are somewhere in the middle. Moderate consumption of these products is usually not harmful. Then the other E is for exercise, and exercise is essential. We need a healthy person, diabetic or not, to exercise 150 minutes every week of moderate activity. or 75 minutes per week from the vigorous activity. And this is an example of what we mean by moderate intensity activity or vigorous intensity activity. And even we used to tell patients to avoid lifting weights and resistance exercise, but now we discover that even weightlifting and short bursts of high intensity exercise are beneficial for the heart, for the liver, and the blood vessels. So A is for hemoglobin A1C, B for blood pressure, C for cholesterol, D for special drugs, E for eating, and E for exercise. Now we go for S, and S is for smoking. Smoking is prevalent in where I live and in the rest of the developing world. We need all patients with diabetes to quit smoking. Cigarettes have more than 7,000 compounds that are toxic, carcinogenic, not only tar, nicotine, carbon monoxide. And quitting smoking after a heart attack reduces the risk by 50%. For patients who cannot resist their nicotine addiction, there are patches and there are medications that can help people who are really addicted to nicotine. And there is a new epidemic of electronic cigarettes, or the vape, or the IQOS. The scientific name is electronic nicotine delivery systems. Up till now, we are not sure of their effect on the heart because it took us 200 years to realize that smoking affects the heart. So we still need time to understand whether these electronic cigarettes are toxic to the heart or not. But we know that they are toxic to the lungs and that they attract people to the smoking arena.
The other person will
S is
continue.
for self-management. We now know that sleep is one of the most important pillars of health. We need everyone to take 7 to 8 hours of sleep every day. And then the last S is for screening. And someone who has diabetes, he needs to talk to the doctor about having screening for 4 organs, and he must do that every year, and we'll take them from top to bottom. First, looking at the eyes. Every patient with diabetes needs to examine the retina because the vessels of the retina can be affected by the high blood sugar and they can result in blindness. And this needs to be diagnosed and treated early. Screening for block in the heart vessels, we're not sure whether it's going to be useful or not. Some people like to do it. Some doctors don't like to do it. But screening for heart failure in diabetes is extremely important because 1/3 of patients with diabetes above the age of 60 will have a form of heart failure. And there's higher mortality from heart failure in patients with diabetes. We can do that screening by 3 ways. By a blood test, it's called proBNP. If it's elevated, then the individual can have heart failure, or we can do that by an ultrasound for the heart or other clinical tools. The third organ that needs to be screened are the kidneys, because the kidneys suffer from diabetes. We need to do an annual test to check for albumin in urine. If there's albumin in urine in a diabetic patient, this is an alarming sign that his kidneys are starting to suffer from diabetes and he needs to do something to protect his kidneys. And the last organ are the legs and the feet. Patients with diabetes may have poor sensation in their feet because the nerves are inflamed and the vessels can be easily blocked and they do not feel it. So they can easily injure their feet having a diabetic foot without feeling any pain. That's why patients with diabetes need to be screened for block in the lower limb arterial tree using a simple test. It's called ankle brachial index, where we measure the blood pressure in the legs and compare the blood pressure in the arms and know if there's block in the vessels of the heart or not. And a question that I frequently get asked is, should all patients with diabetes take aspirin to protect their heart and the blood vessels? And the answer is probably not. If they do not have a heart disease, then aspirin can be dangerous because aspirin can result in bleeding from the gastrointestinal tract, bleeding from the brain. It can reduce heart attacks and it can reduce strokes, but there's always another risk of bleeding that the physician needs to balance before prescribing aspirin. If the patients, we calculate the risk, as I mentioned earlier. If the risk is low, then we don't start aspirin. If the risk is high, then we can discuss with the patient and start aspirin, keeping in mind that it can reduce heart attacks, stroke, but it will also increase the bleeding from the stomach and the bleeding from the brain. So to conclude, diabetes is on the rise in Africa and in the whole world. Diabetes hits the heart and the blood vessels. Every patient with diabetes needs to know his risk of heart disease, and he needs, with his physician, to manage that risk, taking care of the hemoglobin A1C, of the blood pressure, of the cholesterol, taking the beneficial drugs for diabetes and cardiac protection, taking care of the way they eat, the way they exercise, quitting smoking, having good sleep, and screening for the eyes, screening for the heart, screening for the kidneys, and screening for the blood vessels. That was my last slide. I'll be glad if someone wants to ask me a question, whether it's a patient or one of the colleagues, doctor. My contacts are with Mr. Osman, and if you scan this code, you can easily access my contacts and my social media accounts. Thank you again, and I think we have 5 minutes for questions, and I see people now starting to join.
Thank you so much, Dr. Heshmat. That was so beautiful because it's easy to remember when you provide this kind of an acronym-based information.
Yes.
And especially, it's so beautiful.
Beautiful.
And then, triple
And
F.
then, triple F.
I think I'm echoing.
I think I'm echoing myself.
Maybe you could mute
Maybe you
yourself,
could-
Dr. Heshmat. Then I think echo will not come. Can we try that? Or somebody else? Yes, it's okay now. So it was indeed very, very useful. I'm sure, I've taken a screenshot of your QR code and we will circulate as well among our contacts. And I'm sure a lot of people will benefit from your information that you provided. And it was extremely useful. For me, it was like a package. In one package, we could clearly remember how to take care of ourselves and also to communicate this to more and more people. I'd like to invite Usman to come and say a few words. And then if there's any questions who are available right now, we could take that before we conclude. We just have a little over 3 minutes left. Thank you, Usman.
Yeah, hello. Yeah, good evening, everyone. Hello, good evening, everyone. Thank you, Doctor, for the wonderful presentation. I'm so happy because this was first of its kind since we set up this platform. So all I have to say, because of limited time, thank you all for honoring our invitation, and thank you, everybody. So whoever have question, you can ask as fast as possible so that the doctor can attend to your question before we close. Thank you. Thank you.
Thank you, Usman.
No, nobody joined this class.
Anybody has question, you can unmute yourself and feel free to ask a question.
I dropped message.
Have you sent a message on the group with the question?
Okay, hello everyone. Nice to meet you all.
Hello, good to have
Hi.
you with us.
Doctor, thank you for the briefings. We really appreciate. And I wanted to ask a question about the injection you're talking about, like in a week,
Yes.
like for diabetic patients. How
Yes.
do we get this type of injection? I have a mother who is diabetic, and she also have a high blood pressure.
This injection is very easily available here. I'm not sure if it's available in Nigeria yet or not. Perhaps one of the colleague doctors can tell us. It's a bit pricey. It would cost like a few $100s every month, but the benefits are outstanding. in terms of weight loss. As I told you now, bariatric surgery is suffering because of this once weekly shot. I would be glad to help if someone needs the injection. I can talk to the suppliers and try to find a way to make it available.
Yeah, I think that would be very useful. We will keep in touch to communicate further on it.
Okay, thank you very much, Doctor. Thank you. Nice to meet you all.
It's my pleasure. Thank you, man.
I think we have 1 minute left, and I don't see any questions coming up. I would again like to immensely thank Dr. Heshmat. Your humility is heartwarming, so humble. Even though we are virtually seeing each other, we could feel the vibrations coming through through your presentation. It was very, very useful. Thank you, Usman, for connecting this and making us this wonderful presentation. With this, we conclude, and thank you everyone for joining, and we'll continue to stay in touch and keep tuned to this channel through Usman for the next version of another scientific session. Bye for now. God bless everyone.
Thank you.
Bye, Doctor. Bye, Usman.
Hello?
Hello, good morning. Can someone still ask question? Hello? Hello?
The meeting will just conclude now. So we will get in touch with you if you require anything else through Usman. Kindly connect Usman and he'll